So whenever you have somebody that presents with pain, rather than isolating the joint that is affected, you want to take a look at the joints above and below. So we're going to start at the ground, work our way up, and we're going to start at the foot. With regard to the foot, this is a stable joint. And for myself, I work with a lot of professional fighters. And the foot, that is where we generate all of our power. So if we lose stability at the foot, that is going to have a trickle down effect. And all the way up the chain, it's going to affect your power output. So what we would want to do to assess stability at the foot, there are a couple different exercises or a couple different assessments that we could do. The first assessment is very, very basic. I'm just going to have Vanessa roll up her pants a little bit. Ideally, when you are performing these two assessments in particular, you would want to do this on solid ground. You would not want to perform this on turf, but for the purpose of this demonstration, I'm going to be showing you guys on the turf. The easy way to do this, if you have no equipment whatsoever, is index finger. What you would do is take your index finger, you would place it underneath the medial arch, and you want to see if you are able to get the index finger underneath the medial arch. This is an okay way of assessing if they have stability at the foot and if they have overpronation. However, it isn't ideal because if you are a very large therapist and you are treating a very tiny patient or vice versa, you're going to get a false reading. If you're a very large therapist on a very tiny patient, you could stick your finger and you might not be able to get under there, but that doesn't necessarily mean that they have overpronation. It could just be the size differential. So the better way to assess is going to be. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.